Assalamu alaikum. Today we will discuss an important topic, which is RBCs, red blood corpuscles. What is the difference between a cell and a corpuscle? Regarding the steps of synthesis of RBCs, you will study it in histology. You will find that RBCs start from stem cells present in the bone marrow, and it will differentiate into many stages. Finally, it reaches the stage of reticulocyte, and finally the erythrocyte, which is the most mature form. The last two stages, reticulocyte and erythrocyte, are the mature forms, and the erythrocyte is the most mature. Maturation in RBCs is that RBCs get smaller, so the smallest cell in this series is the erythrocyte. And the last two stages, erythrocyte and the reticulocyte, lack nuclei. All the previous stages have nuclei, and a cell without nucleus is called corpuscle. So we can correctly say red blood cells or red blood corpuscles. Regarding the dimension of RBCs, we find that the diameter is about 7 micron, which is nearly the diameter of blood capillary. So inside the capillary, cells will move a cell by cell, forming a row, because of the diameter is equal between RBCs and the capillaries. Regarding the maximum thickness, it is about 2.5 microns. Regarding the average volume, it is about 90 cubic microns. Regarding the structure of the RBCs and the count, we will find that the count is as follow. Regarding normal adult male, from 5 to 5.5 million per cubic milliliter. In adult female, from 4.5 to 5 million per cubic milliliter. So the average between male and female is 5 millions. In newborn, you can expect that the count is higher because of intrauterine hypoxia. We call the infant for age of about 4 weeks, 28 days. For children, the count is smaller, and sometimes we call it physiological anemia. Persons that live in high altitudes will have higher counts than persons living at the sea level. This is because of the relative hypoxia in higher level, because as we ascend upward, the atmospheric pressure decreases and the oxygen pressure and level decreases, causing hypoxia inside our bodies. So our bodies compensate by forming too much RBCs, so you can expect that the count is higher than normal, a condition called polycythemia. Functions of RBCs are oxygen carriage and CO2 carriage mainly. However, there are many important functions like buffering function. This function is done by hemoglobin. It works as a buffer to resist pH change. It also plays an important role in blood viscosity together with fibrinogen, and we said that this is important for maintenance of peripheral resistance inside the vessels, which maintain the normal blood pressure. Regarding the components of RBCs, we have hemoglobin as the most important constituent of RBCs. Hemoglobin structure is relatively simple. It is formed of 4 subunits. The subunits are formed of protein part. Protein part is called globin. This and this and this, all of this are called globin. All these circles are called globin. This is the globin part of hemoglobin. Inside every subunit, we have a heme group. In its center, there is iron in the ferrous state. This is subunit, this is another subunit, and so on. All of these are subunits. So the normal hemoglobin molecule consists of 4 subunits. In the center of each subunit, there is iron in the ferrous state. Each iron molecule carry 1 molecule of oxygen, so every hemoglobin molecule carry 4 molecules of oxygen. We have too much details in this aspect that will be discussed later in the lectures of respiration. Okay, this is another diagram. These are the 4 subunits. This is one subunit, this is the second, this is the third, and this is the fourth, and so on. Regarding the type of subunit depend on the type of hemoglobin. Normally we have two types of hemoglobin. First, the fetal hemoglobin, which is present in the fetus. We have two types of hemoglobin, the adult hemoglobin and the fetal hemoglobin. The fetal hemoglobin is present in the fetal life, and soon after birth it is converted into adult hemoglobin. Regarding the structure, fetal hemoglobin consists of 2 alpha subunits and 2 gamma subunits. However, adult hemoglobin consists of 2 alpha and 2 beta. The total count in every condition is 4 subunits. Additionally, we have many types of abnormal hemoglobin that is present in abnormal conditions like sickle cell anemia, thalassemia, and so on. Regarding hemoglobin content, you have to know these values exactly. These values are so important. The normal hemoglobin content in the adult male is 30.5 gram percent to 18 gram percent. Adult female is lower by 2 units, 11.5 to 16 gram percent. The average in male and female is about 15 gram percent. You can expect that in newborn values are higher and in children values are lower. As we said, children usually have what is called physiological anemia. Later we will discuss an important topic called erythropoiesis, the process of synthesis of new RBCs. Why do we need synthesis of RBCs daily? Because of the continuous death of RBCs. Daily millions of RBCs die because the lifespan of RBCs is from 3 to 4 months and they die every day in millions. So we have to synthesize the same count in order to maintain the normal count of hemoglobin and RBCs. Here we will discuss the factors that control the process of erythropoiesis. You must have to understand them well, because when you are treating a case of anemia, you have to put your hand on the exact cause in order to be capable of treating anemia. So you must have a concept about the requirements or the determinants of the synthesis of new RBCs. The number one is tissue oxygen level, which is the main determinant of the speed of RBCs formation. Other factors like the condition of the bone marrow, the condition of the liver, the hormones of blood that are essential for energizing the process of erythropoiesis, and finally the requirements, which are the nutritional supply in the form of vitamins and minerals. First, why oxygen level is the main determinant. Any condition, whether physiological or pathological, causing oxygen decrease, hypoxia at the level of the tissue, will cause an increase in the rate of erythropoiesis. This is an acclimatization process, whatever the cause I said, whether physiologic or pathologic, like living in high altitudes, like loss of RBCs in case of hemorrhage, cardiopulmonary diseases like bronchial asthma and heart failure, and increased oxygen demand in athletes. This is a physiological condition. Number A and number D are physiological condition, while B and C are pathological condition. Any condition that cause deficiency of oxygen at the level of the tissues will cause acceleration of the rate of erythropoiesis. But what is the mechanism? How this occurs? Whenever your oxygen decreases inside the tissue, we have a sensitive organ, which is the kidney. The kidney becomes hypoxic or ischemic, so it releases immediately erythropoietin. Erythropoietin, the main stimulus, the main energizer of your bone marrow. It is released from the kidney, exactly, and it passes with blood to reach the bone marrow, where it accelerates, energizes the process of RBCs formation. So the link between tissues and bone marrow, which is a factory of synthesis, is erythropoietin. Whenever there is hypoxia, erythropoietin is released in excess amounts it work on bone marrow to accelerate the process of erythropoiesis. Here you can expect that when a person is complaining of chronic renal disease or renal failure, there is no erythropoietin, so he will suffer from severe anemia. So that all patients complaining of uremia, chronic renal failure, or those who undergo dialysis as a replacement therapy will need a daily injection of erythropoietin to compensate for the lost erythropoietin from the damaged kidneys. Erythropoietin is a glycoprotein hormone and it is normally released from the kidney in the adult person, while in fetal life it is released mainly from the liver. Number two, the condition of bone marrow is important determinant of erythropoiesis. Our bone marrow is the factory where the process of synthesis of RBCs, white blood cells, and the platelets takes place. So that any factor that distract bone marrow, that invade bone marrow, that disturb bone marrow, like irradiation, like toxins, like cancers, like chemicals, all of this condition which destroy bone marrow, you can expect that they will decrease erythropoiesis and cause anemia. When bone marrow is destroyed, you can expect that RBCs will be decreased, white blood cell will be decreased, and platelets also will be decreased, a type of anemia called aplastic anemia. The third factor is the liver. The liver has important assistant role in erythropoiesis. It synthesizes globin, part of hemoglobin. So you can expect that patients with chronic liver disease will complain of anemia. Hormones, the energizers of the process of synthesis. The main hormone, as we know, erythropoietin. However, many hormones have role like thyroid hormone, androgens, glucocorticoid, and growth hormone. The fifth factor is so important. Unfortunately, most people forget it. Whenever there is anemia, they come to take minerals, vitamins, and they forget to take proteins and natural vitamins and natural minerals. RBCs are formed of minerals like iron, copper, and so on, and they have a frame of protein. So they must be protein intake. They must be a sufficient protein intake. An important topic applying the study of erythropoiesis is anemia. Anemia means that there is decrease in hemoglobin content or RBCs count or both, below normal, for age and sex. You must study exactly this definition. There is decrease in hemoglobin content or RBCs count or both, below normal, for age and sex. We can note well that the process here depends on the age and the sex, okay? So that what is normal for certain age may be abnormal for another age. So that when a person have a hemoglobin of 12 gram percent, if this person is a female, this is normal. But if he is a male, this is anemia. So the value, whether it is anemia or not, depends on the sex. It also depends on the age. Every sex, every age has its normal value. What about the types of anemia? This is a clinical topic. However, here we can take the basics. Anemia means that there is little hemoglobin content or RBCs count or both inside your blood vessels. This may be caused by destruction of the bone marrow by radiation or by toxins, a condition called aplastic anemia. This also may be caused by deficiency of maturation factors like B12 and folic acid. This type of anemia is called megaloblastic anemia, where the cells are larger than normal. Note well that large RBCs are immature RBCs. Maturation in RBCs means they get smaller, not large. Blood loss from the vessels can be a cause of anemia, whether chronic or acute. Also, hemolysis, destruction of RBCs, whatever the cause, whether hereditary or acquired, also cause a type of anemia called hemolytic anemia. So the basic types of anemia will be blood loss anemia, whether acute or chronic. And this type of anemia may be normocytic or microcytic. Microcytic anemia usually is caused by iron deficiency. Aplastic anemia because of destruction of the bone marrow. So you can expect that you have anemia, leukopenia, thrombocytopenia. When they are together, we call this condition aplastic anemia. The third is megaloblastic anemia because of deficiency of B12 and folic. And the fourth is hemolytic anemia because of RBCs destruction due to hereditary or acquired causes. Thank you very much and see you in next videos.